Appendicitis, as the name implies, well, technically it doesn't imply it, it literally means it, is inflammation of the appendix. This immediately begs two questions. What's the appendix and why is it inflamed? The appendix is this little dangling dead end piece of your intestinal tract that normally hangs just beyond the ileocecal junction. It's sometimes described as being roughly pinky sized and pinky shaped. Although, if your pinky looks like this, you should go see a doctor and maybe reconsider some life choices. The reason the appendix gets inflamed is it's an anatomical disaster. It gets obstructed relatively easily by feces, what a horrible word that is, undigested food, or a foreign body, which leads to bacterial overgrowth and inflammation. If the obstruction persists long enough, bacteria can invade the wall of the intestine and lead to ischemia, gangrene, perforation, and abscesses. If any of those things happen, you have what is euphemistically called a complicated appendicitis. Otherwise, it's a simple appendicitis. The classic story of appendicitis is acute onset abdominal pain that increases with movement and palpation, loss of appetite and nausea. The pain often starts out diffuse and around the belly button, then, within 24 hours, localizes to the right lower quadrant of the abdomen. Some patients also have fevers, especially if they've been sick for more than 24 hours. Now, if that's all the doctors had to go on, they could tell the family that there's something wrong with the belly region, which is succinct, technically true, and not very helpful. To actually diagnose appendicitis, we need imaging. Typically, we start with ultrasound because it's quick and cheap, but sometimes the appendix is shy and we have to do a CT to find it. What the docs are looking for is a dilated appendix with thick walls, basically a beefy appendix. The treatment for simple appendicitis is IV antibiotics and a laparoscopic appendectomy, known affectionately as a lappy, which to me sounds like a lapdog of some kind. The treatment for a complicated appendicitis is, well, more complicated. If the appendix has ruptured, the patient may need to spend days or even weeks on IV antibiotics, with a Salem sump sucking everything out of their GI tract, which is miserable. These kids can't eat. If they did, the food would just get sucked back out of them. So they usually need parenteral nutrition, i.e. a PICC line with TPN and lipids. Once the GI tract is cleaned out, the Salem sump is removed, the patient is allowed to eat, and they're sent home on antibiotics. A few weeks later, they have to come back to get the tattered remains of their appendix surgically removed. Because there's an interval between diagnosis and surgical treatment, these are referred to as interval appies, which to me sounds like a second round of appetizer served when dinner's running late. These kids are at some increased risk for developing adhesions that can lead to small bowel obstructions. Another potential complication is an abdominal abscess. These are treated with IV antibiotics and, when the abscess is drainable, well, a drain. A patient with a simple appendicitis can be in and out of the hospital in less than 24 hours. A complicated appendicitis can keep a patient hospitalized for weeks.